Okay. Good evening, all.
Good evening.
Good evening, ladies and
Good
gentlemen.
evening.
Welcome. I hope we can hear each other well and see each other. For those of us that can see each other, and for those that we can't see, we know there are a few participants that are streaming in gently and joining us as we begin this 1 hour solution-driven, impactful talk about the South Bronx and the root causes for systematic and the health disparities that we see in this particular part of New York City, which has been rated the lowest in terms of so many categories that you can think of. My name is Oiza Adaba. I'll be your moderator for today. This session is hosted by Word of Life International and headed by Reverend John, Pastor Felicia Udo Okon. It's a Bronx-based non-profit organization that has been in existence for some time and has been helping people, the community in the area, to achieve its goals. And we have a packed series for you. This is part of a 5-week series. It's going to be very intense. So if you're just joining us, please make sure that this is not the last time you're going to be with us. It's very, very important that residents and the community activates their voice in learning about some of these issues that are predominant and are seen in this part of the world. So without further ado, I am going to introduce our host, Reverend Dr. John Udo Okon. He started the Word of Life ministry, and he started with the Word of Life Christian Fellowship International in the Bronx, and he's the executive director of the Word of Life International. Thank you, Reverend John, for hosting this very, very interesting and much needed panel. Great. Reverend John, you're on mute, but that's quite all right, because I'll go on next to introduce Dr. DL. And Dr. DL Helwit Jr. is an infectious disease specialist and a fellow of both the American College of Physicians and the Infectious Disease Society of America. He serves as a member of the COVID-19 Task Force of the National Medical Association. That's the collective voice of African American physicians and the leading force for parity and justice in medicine and the elimination of disparity in health. He's also an active member of the NMA's local chapter. That's the Westchester Bronx Society of Black Physicians. Dr. Helwit is also a medical director of the Division of Disease Control for the Westchester County Department of Health, the infectious disease consultant, and the co-chair of infectious control and prevention for Calvary Hospital in the Bronx, an adjunct associate clinical professor of microbiology and immunology at the New York Medical Association. So I'm sure by just reading Dr. DL's Helwit's bio, you can see that Word of Life definitely reached out far to bring him such an expert and such a valued voice. We welcome you, Dr. DL Helwit Jr., to this forum.
Thank you very much, Ms. Adaba. And I am honored to be here this evening. It is always important for us to try our best to spread objective scientific information in a way that everyone can understand it. And so it is certainly an important opportunity for me, especially at this point in our society. So with that, I'd like to have the first slide, please. And just as background, when I first started my career, my first assignment was at Lincoln Hospital, which of course is in the South Bronx, and I was working in the infectious disease division of that hospital for the first 9 years of my career after finishing my training. I don't know if we can have the first slide brought up.
Just one moment, please.
Okay.
And your experience there in the South Bronx, how can you relate with where your position is right now while we're waiting on the slide to come on?
Well, I relate very closely. I always feel a linkage and a kinship with the Bronx. Of all the areas where I've worked in New York, I have spent more of my career in the Bronx than anywhere else. And when I started my career at Lincoln Hospital, we were actually just at the beginning of the HIV epidemic. And that was surely an example of a health disparity, because there was a disproportionate amount of disease and actual morbidity and mortality that we saw in our patients at Lincoln Hospital, our African American patients and also our Latinx patients. That was what we were seeing at that time. And I grew up essentially at that hospital. And then, of course, I had many other assignments thereafter.
Okay.
So
let you take us through the rest of it.
Yes. Okay. Thank you very much. Okay. So this is just the title slide, and I'm honored to represent the National Medical Association. And as was mentioned earlier, I am honored to serve on the task force for COVID-19, the COVID-19 vaccine. And just to give you a word on that before we start the talk, because of many of the things that have been going on in the society, there is a lot of concern about the development of a vaccine. People are concerned about the safety. They're concerned about whether a vaccine will actually work. And when surveys were done in our communities among African Americans, in many of the communities, it was found that less than a third of people would actually be willing to take the vaccine if it was made available. And that had to do with a lack of trust that we as African Americans have in our healthcare system. And the reason for the task force is so that we will have trusted individuals to provide us with guidance in terms of the information that comes out of the scientific studies, so that we can assist and support. We as a group believe that there is going to be a safe and effective vaccine that's going to be available, but we want to make sure that things are not done in a rushed manner, and we want to make sure that shortcuts are not taken which would be detrimental to the health of everyone, not only the members of our community, but the members of all of the communities here in the United States and around the world. And so that's really the focus of our task force. So I'll go into the actual discussion now, if we can go to the next slide. So you may be interested in knowing, and the purpose of these talks, I think, and the purpose of this talk as well as the talks that I give, it's really to stimulate your thoughts, to give you information that will stimulate you to look into this in more depth, and to inspire you to do things, to make changes in our community, because it's one thing to see the data, and sometimes when we see the data, it's very depressing, but we can do something about this. We don't want to just sit around and say that it's all doom and gloom. We can do something about this. And so that's really the purpose of this kind of presentation, to present this to you. And we'll start with going over some general areas, and then we will focus on COVID-19. So disparity in mortality is not a new problem. 30 years ago in the New England Journal of Medicine, one of our mentors, Dr. Harold Freeman, at the Harlem Hospital, he was actually the chair of surgery there. He and Dr. McCord wrote a paper, and it was looking at mortality rates in Harlem. And they noted at that time, 30 years ago, that mortality rates had declined for both white and non-white Americans. And national averages obscure the extremely high mortality rates in certain inner city communities. They used data from the 1980 census, that's 40 years ago now, from death certificates in 1979, 1980, and 1981, and they examined the mortality rates in central Harlem. At that time, it was quite different than it is right now, of course, with the gentrification that has occurred. And at that time, 96% of the inhabitants were black, and 41% of the inhabitants lived below the poverty line. And for Harlem, the age-adjusted rate of mortality from all causes was the highest in New York City. That was at that time in 1990, more than double that of the United States overall, and for whites, and 50% higher than of all U.S. blacks. If we go to the next slide, So almost all of the excess mortality was in those less than 65 years, which is really very interesting. So with the rates of the white population as the basis for comparison, the standardized adjusted for age mortality rates for deaths under age 65 in Harlem were 2.9 for males and for male residents, and 2.7 for female residents, which is a high ratio. The highest ratios were for women between the ages of 25 and 34 years of age. And these are people that are in the prime years of their life. For men, 35 to 44 years. The chief causes for excess mortality at that time were cardiovascular disease, cirrhosis, homicide, of course, and cancer. We go to the next slide. And they did a survival analysis, and this was the shocking thing that they showed. In the survival analysis, they showed that black men in Harlem were less likely to reach age 65 than men in Bangladesh, which of course everyone knows was one of the poorest countries in the world. So of 353 health areas in New York with a total population of 650,000 had a mortality rate of, for persons under 65 years old, that were at least twice the expected rate. And all but one of these areas of high mortality were predominantly black or Hispanic. So of those 353 health areas in New York, all of these with the high mortality were predominantly black or Hispanic or Latinx. And the authors concluded that Harlem and probably other inner city areas with largely black populations have extremely high mortality rates that justify what would be considered special consideration, analogous to that given to natural disaster areas. So this is how we start our discussion here today. We go to the next slide, please. So pandemics of the poor, and this again is in general, before we even got to COVID, social disadvantages and the U.S. HIV epidemics. We found that minorities of color, sexual minorities, poor access to antiretroviral therapy and issues with compliance and disinformation, and access to preventive therapy, all of these have created the situation in which there is a disproportionate amount of morbidity and mortality in our communities. The same has been true with hepatitis C infection. Recently, there have been effective therapies for hepatitis C, but we still have a disproportionate number of the deaths and morbid events that are occurring in our communities. African Americans aged 60 and older are 10 times more likely to be chronically infected with hepatitis C, and African Americans comprise approximately 11% of the U.S. population, but we represent 25% of the people with chronic hepatitis C infections. And it's one of the 10 leading causes of death among African Americans between the ages of 45 and 64. And this is before we even get to COVID. If we go to the next slide. Next slide. Okay, so let's talk now about the COVID pandemic and racial disparities and the background here. So prior to the current pandemic, an exacerbation of pre-existing disparities in our national health system was due in part to what we would refer to as a systematic, willful dismantling of the basic pillars of the infrastructure, including the Affordable Health Care Act, or Obamacare, and the Medicaid system. These recent acts exerted a particularly devastating impact on our lower income communities across the nation, including, of course, those here in New York City and the Bronx. Recent cuts to funding of the National Centers for Disease Control, reductions to research budgets of the National Institutes of Health, funding cuts to the Food and Drug Administration, and the disbanding of the task force which focused on prevention of pandemics and emerging infectious disease threats have been detrimental to the lives of all U.S. citizens, especially those who are in underserved communities. So keep this in mind. All of these things occurred before we had a pandemic. All of this dismantling, all of this taking apart, all of this defunding occurred before we even had a pandemic. The reductions of access to primary medical care through massive cuts in our Medicaid program also has impacted disease control among our low-income African Americans and Latinx, and has contributed to the loss of life associated with the COVID-19 infection. We go to the next slide. And so when we look at why are these disparities occurring, these disparities in outcome, most agree that disparities are not due to genetic or inherent differences in susceptibility of African Americans or Latinx to COVID-19. The disparities are most likely due to a combination of factors that have cumulative created a tragic, what we would call a perfect storm, if you will, within our communities. The magnitude of the disparities in death rates among African Americans and Latinos impacted by COVID-19 can be explained by several medical and socioeconomic factors, which likely include the following. And I will preface this by saying that as a group of African American physicians, we put together a position paper, and this position paper was presented or filed with the Congressional Black Caucus, and we were appealing to the Congressional Black Caucus to look at this and to examine these things and to try to come up with some actions that could be taken. So we were calling it a call to action. So higher rates of preventable underlying chronic diseases and medical conditions exist, and that's a factor. Limited or total lack of access to primary medical care was a factor. Limited access to the diagnostic testing, resulting in a failure to diagnose individuals with COVID-19 infection and subsequent failure to place those infected individuals on isolation to prevent the spread to others in the community. That was a factor. And also, importantly, and keep this in mind, a lack of awareness and misinformation, which is pervasive in our communities. Next slide, please. So according to recent data that was released by the CDC, over 90% of patients in a cohort study of 1,482 hospitalized patients with COVID had underlying medical conditions. And these conditions, I think all of you are familiar with. They included hypertension, obesity, metabolic disorders such as diabetes, chronic lung disease, including asthma, and of course, cardiovascular disease. As Dr. Anthony Fauci stated in one of his hearings with Congress, the impact of COVID-19 is shining a very bright light on the unacceptable health disparities for African Americans. This is according to Dr. Fauci. We go to the next slide. Now, this is an interesting slide, and I want to walk you through this data. These are some of the comorbid factors by race and ethnicity. And if we look at the medical conditions there on the left-hand side of the slide, we have hypertension, obesity, diabetes, and asthma. And if we look at the rates among non-Hispanic blacks or African Americans, 40.3% compared to 27.8% in the non-Hispanic white population and 27.8% in the Hispanic population. So certainly hypertension is a much more common and serious problem among our black population. Obesity is another major problem for us, and this, of course, has led to an increase in morbidity and mortality in individuals with COVID. And what do we see here? 38.4% rate among African Americans or non-Hispanic blacks, 32.6% among Hispanics, and 28.6% among the non-Hispanic white population. For diabetes in men and women, 12.2% and 13.2% versus 8.1% and 6.8% in the non-Hispanic white population. And asthma, 9.6, the prevalence is 9.6 per 100,000 with a rate of a cumulative incidence of 10.7%. And for the white population, you can see that we exceed it there. Asthma is an even bigger problem in our Latinx community. So this is one of the reasons why we are seeing more problems with COVID, because when you look at the disparity here in terms of the underlying medical conditions, you can see very clearly that we are overrepresented. We go now to the next slide here. Now, these disparities were discussed, and when you look at some of the population data, it's very, very apparent, and there are numerous examples. These are just a few that we have, I guess you would say, almost cherry-picked from all of them. But Chicago Mayor Lori Lightfoot, back in April, that was when we presented this paper, she noted that African Americans comprise 72% of the COVID-related fatalities in her city, Chicago, yet African Americans make up less than 30% of the population. The Associated Press back in April, the mayor went on to, this was in the Associated Press, and the mayor went on to mention that the state of Illinois, 43% of those who died as a result of COVID were African Americans, while African Americans comprise only 15% of the state of Illinois' population. Here in New York, the New York Times reported that in New York, Latinx and blacks are dying at twice the rate reported in white people. Hispanics accounted for 34% of deaths in New York City and make up 29% of the city's population. African Americans accounted for 28% of the COVID deaths, and we made up 22% of the population. White New Yorkers account for 27% of the COVID-related deaths, but they make up 32% of the New York City population. So these are some of the striking disparities that we see. If we go to the next slide. So if we go further, in other states, it was the same situation. In Michigan, African Americans accounted for 40% of the COVID-related deaths, but only make up 14% of the population. In Wisconsin, Milwaukee, Wisconsin, African Americans comprise 26% of the population, accounted for, of the 945 reported cases, 81% of the deaths as of early April. And that these trends have continued. Public health authorities also reported similar findings in the state of Louisiana, where African Americans accounted for 70% of deaths compared to 33% of the population. And that was one of the most striking examples. And that was a paper that was published in the New England Journal of Medicine. I believe it was back in May or June. The next slide. Now, in addition to the medical factors that we pointed out, there are very important socioeconomic factors that lead to the disparities. In New York City, African Americans and Latinos, when combined, account for the majority of what we call the frontline workers. And there were 6 categories of these frontline workers. And one of the important things here is that we heard a lot about working remotely, working from home. If you are a frontline worker, you cannot do your job from home. If you're an emergency medical service worker, if you are a truck driver, if you're a postal worker, if you work for building services, if you work in a grocery store, if you work in a pharmacy, if you are a child care worker, if you are a transit worker, you cannot work from home. And we are overrepresented in these positions, these frontline positions. All of these occupations place individuals at higher rate for exposure to COVID. And if you look at the statistics that were recently reported, we had terrible results in our transit workers, our bus operators, and our train operators and conductors, and also among individuals who were police officers, emergency room workers, nurses. So all of these are factors as well. If we go to the next slide, please. Also important here, and we can't leave this out, is limited access to health care. And if you limit access to health care, it will undoubtedly widen the disparities. And we've already alluded to this, but Medicaid public health insurance program is intended particularly for people with low income, the elderly, and the disabled. This program provides health coverage for 1 out of every 5 Americans, and it finances the hospitals. So when you cut this program, you're not only cutting people off, but you're cutting resources to hospitals that serve our communities. And in 2010, the Affordable Health Care Act, Obamacare, expanded Medicare access to non-elderly, low-income adults. And in 2018, the current administration proposed enactment of an $800 billion cut to the Medicaid program. Initially, that was projected to take place incrementally over the subsequent 10 years. The projected budgetary cuts to the Medicaid program would approach $1 trillion over the subsequent 10 years. The proposed reductions in Medicare program by $750 billion over 10 years will also exert a negative impact on the bottom line of hospitals and also on medical providers who provide care for our underserved patients. The next slide, please. We're starting to wind it up here. Misinformation and disinformation, apologies for the way this came out. This is very important. There is so much propaganda that is out there. There's so much misinformation and disinformation when you go to the internet. And at the onset of the COVID-19 pandemic, many in our African American communities and other underserved groups received information from sources that were not credible. This misinformation posed a danger to our communities, and some of it was that African Americans couldn't catch COVID, and then when they had further information, well, it doesn't affect children. Just as an aside, in Westchester County, we saw 43 children who had to be admitted to the intensive care units, and there was 1 death in a child as a result of COVID. And so this was misinformation. So the NMA and other medical associations, we must combine efforts and collaborate with credible groups in providing objective, reliable information concerning COVID-19 for the underserved and underrepresented populations across our country. We have to understand the importance of preventive modalities. We have to understand that we need to wear masks and face coverings. We can't do what they do at the White House. We must exercise distancing. We must avoid large crowds. We must avoid large gatherings. The pandemic is not yet over, and I'm sorry to editorialize. We also have to be on the lookout for when vaccine candidates come out, and when they are approved, we want to make sure that if these are effective and safe, that we avail ourselves to these preventive measures. Also, therapeutics. There are new therapeutics that are being developed. We want to make sure that we're aware of these things that can be done and that we avail ourselves to those as well. If we go to the next slide. And so these are some potential solutions that we are proposing as we close here. We want to identify reliable, objective sources for health information. We hope that all of you will do that. Your physicians, your professional practitioners, other members of your various groups, identify reliable, objective sources and share that information with your families, with your friends, and with your loved ones. Be proactive in managing your health And I should say also, as you share information, sometimes you have to have what we call the difficult discussions. And you try to have those discussions where you may disagree, but you try to disagree without being disagreeable. But it's important for us to try to pass on that information that is important for people to hear. Make sure people hear the information that they need to hear and not the information that they necessarily want to hear. We want to be proactive in managing health, managing hypertension and diabetes, weight control, respiratory disease, avoiding things like smoking, managing our obstructive lung disease. Engage our family and our friends in constructive, healthy, cordial discussions about health. Engage your legislators, the leaders in the city government and local government and all levels of government. Go to the town halls, find out what is going on, find out who our legislators are, and make sure that your voice is being heard. And of course, at the end, we want to make sure that we exercise our right and our obligation to vote. And so with that, I will close. It has been truly a pleasure and an honor to talk to all of you this evening, and I hope that we can further engage if there are questions. But thank you very much for listening to this presentation.
Thank you very much for that very insightful presentation, Dr. D.L. Hillwith. You touched on so many issues. I would allow you catch your breath for a minute.
Thank you.
And I'm sure our participants as well, have questions lined up, for you on some of these very real for residents of the South Bronx, very, very real issues that you have talked about. Before I come back to you with some of those questions that I have and also our participants, I'd like to call on Reverend John. Reverend John, are you with us?
Yes.
Great. It's great to hear your voice. We're supposed to hear
Thank you.
earlier than now, but I actually wanted Dr. Hillwith to lay down the issues, some of the fundamental problems as he has clearly outlined, and also, proffer some of these solutions that we're seeing on our screens right now. But why I wanted you to come in at this particular time is you have real life experience on ground with what has been going on. Please give us your remarks on what has led you to bring us all together here today. And then we'll come back to Dr. Hillwith.
Thank you very much, Oiza. I want to welcome every one of you and to thank you for being a part of this webinar. My wife and I really appreciate, you are taking the time to join us in this conversation. I want to say that this project is made possible through a chalk mini grant of $1,500 that was provided to Word of Life International by New York Presbyterian Hospital. And when we received this award, initially, this was before COVID-19. Our intention was to focus on adult literacy program. But with the COVID-19, Word of Life was greatly impacted. And we decided to change the focus from adult literacy to have this program so that we can focus on the public health crises and the failures that we had experienced as a result or during the pandemic. I want to say that Word of Life is very appreciative of the partnership, the guidance, and the assistance that we've received from Interfaith Public Health Network, pioneered by Mr. Roberts, and Kelly. They have been of great help to us even before COVID-19. They have been helping to guide Word of Life in our administration of health programs or services in the South Bronx. Now, Word of Life has been serving the South Bronx for the past 20 years. We began as a local church and as a hunger relief organization. We run, I believe, one of the largest food pantries in New York City, and this benefits quite a large population. Now, as a direct service provider, we've also realized that people have needs beyond food. And so we've been privileged to have two clinicians, Miss Jane Barry and Miss Cologne, who have been working with us to provide counseling and also link our clients with supportive services. They provide these services free of charge, pro bono. Now, as a result of COVID-19, Word of Life had to redesign and rethink of the ways that we provide services. Now, one of the challenges that we had was, many people think that COVID-19 started by March this year. No, COVID had been with us. And Word of Life, being a direct service provider, our food pantry saves hundreds of people every week. On a typical Saturday, we have maybe like 500 people. And our staff and volunteers have to interact with these people. And the situation is that by the month of March, many of us contracted the virus. And the unfortunate situation was that we are considered an essential service, which means we must be out there providing food to the people. But we had no access to any personal protective equipment. We did not have face masks. We did not have anything to protect ourselves. But we were out there every week saving the community. We tried as much as we can to reach out to the Department of Health. We reached out to city council members. We reached out to the mayor's office. We told them that we were in need. We told them that we were, many of us were getting sick. But we were told that much attention was being given to hospitals and other health care. So the food pantries and the soup kitchens we were working without any assistance. And being a compassionate program, we had to be out there providing services to the people. And so our voices were not heard. And like I said, many of us eventually contracted the virus. Myself, my wife, my son, who works in the food pantry, we all contracted the virus. And by the month of April, we basically had to close. We shut down because so many of us were sick. But thank God we recovered, and we got. We did reach out to Robin Hood Foundation, who gave us a grant, and we were able to get some protective equipment, which enabled us to restart the pantry first week in May. I want to say that COVID-19 really exposed the challenges, all the disparities that exist in the South Bronx. And the South Bronx, being a poor neighborhood and not really having a voice, we were not able to really proactively advocate for ourselves. And it is my hope that with this webinar, we'll be able to think as a community and see how, we can be able to design and come up with ideas and ways that can enable us to continue to provide the much needed services in our community, and to have a strong voice, and to be able to draw attention to the plight of our community residents. So I really want to thank all of you for being here today, and especially to Dr. Hewlett for accepting to speak to us today. We hope that you enjoy the presentation and that you will make yourself available so that you can continue with us for the next couple of weeks. God bless you. Thank you.
Thank you very much, Reverend John Udo Cohn, founder and convener of Word of Life International. They do amazing work. I've been there. I spend my Saturdays there, in more recent times, and just seeing the amount of work that Reverend John and Reverend Felicia put into the community, and they've been doing this for over 17 years. It's just simply showing nothing short of amazing. The photos that we just shared are just a few of some of the great things that they do in the community. But I'd like to thank you again, you and your precious Reverend Felicia, for putting all this together. While I come back to you, Dr. Hewitt, before we throw open the floor, especially to our participants, to also get their questions in, we're trying to move forward now. What is the future? What should we be concerned about? It's flu season, and then the weather is changing. So what should we be concerned about, and how is it going to be handled? Can we trust that this can be handled properly?
Yes, I think that we can trust that it will be handled properly, and I'm glad that you were asking that question. There are so many things that we can do as we are waiting for the approval of a vaccine or vaccines as far as COVID is concerned. But as far as the flu is concerned, every year we know that during the fall, especially in the fall and the winter, we almost always will see outbreaks of the flu. The flu is preventable, and although there has been some skepticism by many people about the flu shots, I urge everyone to take the flu shots, to make themselves, to give it to yourself and also to your families. Also, it is one of those immunizations which should be given to our pregnant women. And we know that the flu during pregnancy can be extremely dangerous, and we should encourage our young women during pregnancy to obtain the flu shots from their obstetricians, and even our young children, our infants, 6 months of age and older. I've made sure that my grandchildren have received it, and I would urge everyone to make sure that their children receive it as well. And that is one of the positive things we can do, because the flu can cause a disease that can mimic COVID and vice versa. So that's one of the things we can do. As we're waiting, as we said also, the same preventive measures that we have tried to take as this pandemic has gone on, the face coverings or masks, the distancing, and although it is very painful for all of us, those of us who enjoy fellowship, I think we have to delay and defer a lot of those large gatherings until this pandemic has really run its course. So these are some of the things I think that we can do. I think that we can remain optimistic as well, because I do think that this is something that is going to pass, but it is a formidable situation for us.
Mm. Well said. Dr. GL, many African countries have, they've been leading innovators in creative responses, so far to the COVID-19 crisis. We see a lot of their numbers are down. And what can we learn from them? What are they doing right that we're not in these parts of the world?
Well, again, stepping off of the medical type situation and looking at some of the societal types of things, I think that we have been the unfortunate victims, if you will, of an extremely divisive administration. And I think that if you have an administration and a society where there's a coming together and where everyone is understanding that they are part of the solution of the problem, and that people are made to feel that they are responsible for one another and that they're not encouraged to fight one another. I think that that is one of the things that is going to work. And I think that that is something that has probably worked very well in many of the countries outside of the United States. Certainly, I would think on the African continent. And I think that that's part of it. I hope that as we move forward, that we will have a government that will encourage us to come together and not to fight with one another and to have such a divided situation, because the divisiveness has led to the lack of response to this pandemic. And it really should never have been politicized, but in this country, unfortunately, it has been.
Thank you very much for that. I'd like to call on Robert from the Interfaith Public Health Network. They helped put this together, this wonderful webinar. So what they do is engage and enlist diverse faith communities to improve public health through connecting potential partners, convening constructive dialogues such as this one, and cultivating health understanding and catalyzing social change. So I'd invite Rob. Rob, I don't know if we have any questions from our participants that have been listening. Hello, participants. Thank you so much for your time to join us this Thursday evening. And we hope that you'll continue this every Thursday and invite your friends. Rob?
Thank you, Oiza. I haven't seen any questions come through the chat yet. I do have an additional question for Dr. Hewlett while we're waiting for questions to come in. So that would be, we've heard a lot lately about airborne transmission. I know that there was a report from the CDC and perhaps there was some political shenanigans involved with that. Do we have anything to worry about in terms of airborne transmission moving forward into the fall and winter? And are there special concerns with that in the South Bronx context?
Well, yes, I think that it's fairly well established that transmission is airborne, and it is not unlike other infections that we have encountered over the years. What we can do, of course, is the face coverings. The face coverings are essentially like a social contract. The face coverings actually will make it less likely that you are going to pass infection on to other people. And they, in turn, if they wear the face coverings, they make it less likely that it's going to be passed on from them to you. That is, I think, one of the main things we can do. The other reason for the distancing, I like to call it spatial distancing as opposed to social distancing, because we want to remain social, but we have to put space between ourselves to limit the likelihood of transmission if one is infected and someone else happens not to be. But we know that this will also help us as well. And that is one of the other things that we were talking about with the larger gatherings. So all of these things I think will help. The reason why we probably saw surges as we went into the summer in certain areas of the country is if you think about the seasons of the year, in the southern states and in some of the western states where it's extremely warm, during the summer months, people will actually have to go inside. And they are in the air conditioning, and that was increasing the spread of the infection. When we have to go inside during the winter time, as the weather gets colder, that is when we start to see more of the infection spreading. That certainly is true of the influenza, and it also is true for COVID-19.
Thank you. And it looks like we have a hand raised from Yolanda John. If Yolanda John could unmute and share your question.
Yes. Hi.
Hello.
My question is, they're talking about the second wave of the COVID-19. So
Yes.
my concern is like, and it should be dangerous than the first one. So how worried should we be, or what precautions should we take, or?
Well, I'm glad you asked that. We are already witnessing what we would call the second wave, and in fact, some people are saying that we may be in what would be considered a third wave. The second wave, according to many people, was occurring when in the summertime, when we started to see an upsurge of cases in the southern United States. But here in the New York area, we have definitely seen an upsurge in cases. In I don't have all the figures for the Bronx, but I do know that in Westchester County, where I'm working right now, we saw a 37% increase in hospitalizations during the past week. And that is very, very troubling. We have seen increases in cases in children in the schools around the county. And the same is true in the New York area. So I think that one of the factors that's involved is that some of our younger people are not really taking this seriously. Some of our college age students are not really taking the types of precautions that they should. I think that we have to stress to them how important it is. I know how difficult it is when we are trying to raise teenagers, when we're trying to provide guidance for college students, because they, of course, know everything. But we have to try to keep them on track and remind them that this is still going on. This pandemic is not over, and they have to continue to exercise the precautions. I think that those of us who are in the more seasoned group understand how dangerous this is. Just as Pastor said, he and his family had the infection and they know how serious this is. And we have to keep stressing that this is not something that we can play with.
Indeed. Indeed. And there has been a research and anecdote and reports pointing towards the higher rate of alcohol consumption. That was just your last point was just a good segue into this. It shows that people who consume alcohol are drinking, people are drinking more during this period. And that can't be good, can it, Doctor?
No, it's not. And I think that part of this had to do with the social isolation that's occurring. People have been confined to their quarters. People have been on quarantine. And this is something that has been seen. There are even reports of an increase in the consumption of certain types of beverages, where there's actually been a decrease in beer consumption and an increase in the consumption of some of the other more potent forms of alcohol. So this, as you said, it's not a good thing as far as the society is concerned.
Do you have any last thoughts, Dr. Hewitt, before I pass it on to our host, Reverend John?
The last thoughts are, I think that what we said on that last slide is that we have to remain engaged. We want to remain involved. We want to acknowledge the fact that this is not going to go away. There are things that we can do to help ourselves in terms of our own health and engage our legislators, make sure that we engage all of our community leaders, and of course, last but not least, we have to make sure that we exercise our right to vote. So thank you very much for having me on this program. It's been an honor to be with you this evening.
No, we appreciate your words. Thank you so much, Dr. D.L. Hillwit, for taking the time to, really educate us about what is going on and what the future looks like. It's hopeful coming from Dr. D.L.'s lips. So we hang on to that hope. Thank you.
Thank you.
And to Reverend John Udo-Okon, I'd like you to round us up in as we wind down here. Talk to your community, your South Bronx community. what would you want them to know, and what are the important things that they should hang on to during this period?
Well, I just want to thank everyone once again for joining us tonight. And I would like to say that I love the South Bronx. It's a strong community. And we have survived so many tragedies, so many crises. Unfortunately, we have continued to be vulnerable. But I believe that as a community, we can organize ourselves and not wait for people from the outside to help us. Not to wait for people from the outside to provide all the help that we need. There are basic things that we can do. And I believe as we continue with this series of workshops, we're going to find that there are simple things that we can do. And I also want to thank Deborah, who is also on this webinar. Deborah, when she got to hear that word of life, we were going through the crisis when so many of our staff and volunteers got infected. She, on her own, organized people to begin to sew face masks for us. And she supplied us with, I believe, close to 200 face masks, all sewn by some women in the New York area. So I really want to say there are things that people can do individually. I also know of, I also want to talk about Deborah Estrain, who was also on this call, who also, having heard of the challenges that we were facing in Word of Life, she reached out to us and has been helping with fundraising to support our services. Now, the big picture here is that we want to organize ourselves. That's why I'm so glad that people like Larry Robinson, community leader, the vice chair of Community Board 2, join us tonight. He's a trusted voice in the community, and we need trusted voices. We need people that can speak, of the needs and the challenges that is being faced in the community. We need the people that have the interests of the residents in mind, because to say the truth, a lot of people look at the South Bronx as a place where they only come either to work or to do business and go. And we need the residents to get involved with issues that affects them. We are hungry. We happen to be the most hungriest community in New York City. We happen to have all the health indexes, all the bad health indexes, high rate of obesity, high rate of high disease, high rate of high blood pressure. Everything that is bad, we have it. And to some people, this is good news because it is good for their business. But we as a people, we as a community have to take an action to address our needs, to solve our problems, and to work with our elected officials to come up with real solutions that addresses poverty in our community, that really address the health challenges or disparities in our community. If the people don't rise up, if we don't rise up, if we don't work, if we don't get involved, 50 years from now, just as it has been, we will continue to remain the poorest districts, will continue to remain the district with the highest health disparities in the country. So I want to thank every one of you, and I want to please request, let's reach out to our friends and colleagues and invite them to join this forum. And we don't think that we have all the solutions, but I believe that there are simple things that we can support and do together. Thank you.
Thank you very much, Reverend John of Word of Life International. It is a great start. Thank you so much to everyone that all our participants, our great guest speaker, Dr. D.L. Helwood, our friends from our Interfaith partners. Thank you so much for joining us. Great participants of the Boogie Down Bronx, the home of hip hop, the home of the graffitis. We have so much in the Bronx to celebrate, no matter what anybody says. So let's continue in that spirit of staying healthy and staying as each other's keepers here. I am Oiza Adaba. I'm with Africa Related. I've been your moderator, and I hope to see you in the next 5 weeks. We're going to do this for 5 weeks. So bring your friends, join in, and let's participate. We'll be emailing you a survey to all registrants along with the information about next week. So see you next week, and thank you again. Be safe.
God bless.